So let us continue with Nash Therapeutics Study Streak, a book which has inspired me in my earlier days of homeopathic practice, and so will it to all those who go back to this book each year and take inspiration from Dr. Nash, because the book he writes, Leaders in Homeopathic Therapeutics, it's not just a collection of materia medica symptoms, but also his personal experience, his struggles with homeopathy, his struggles with understanding how potencies work, how dilutions work, coming from the background of allopathic school practice. He was very skeptical, and how he succeeded in making amazing cures and leave a legacy for all of us to read. Leaders in Homeopathic Therapeutic Study Streak, and today's remedies that we will discuss are anacardium, alumina, and alumen. Almost similar remedies and have their action on the mind and some other gastric organs. Let us go and go through this remedy. For anacardium, I very well remember in my earlier days also, there was a patient who was not improving on any medicine, having the complaint of loss of memory. And it used to be for small, small things. And I gave him everything like Brahmi and Bacopa Muneri and Kali for 6x and in dilutions and all. And he was a young child of around 10, 12 years, and I didn't understand what to do, and I was getting hopeless in the case, and they were ready to take allopathic medicines because they already did some course and they didn't find it useful, and they were already getting an opinion from another super specialists. But what was interesting was that this child also had some loss of memory, and that's where I gave him anacardium after the failure of Nux, Califos, and Brahmi and Bacopamoneri and everything. The moment I gave him anacardium, within 15-20 days, I saw some good change. The mother reported that he's not forgetting, he's remembering everything very well, and he is also improving in his appetite earlier, which was not so much good. I don't very clearly remember the gastric symptoms. Sometime later, I'll put this case, but anacardium as a remedy by Dr. Nash. He has mentioned that this remedy is not appreciated by our school, and it is useful for complaints which have hydra headed manifestation like dyspepsia. Now nux vomica is indiscriminately used left, right, and center in our school, and we all homeopaths have been using and abusing this drug. We all have some of our favorite remedies. I have put up a reel also for everyone to understand that sometimes we focus on only one aspect of the case just because we know only a few remedies, or we only know some aspects of some remedies. But if we open up our avenue, which is by reading different authors, different sources, we will be able to prescribe a large number of remedies by comparing, differentiating one remedy from the other. And this is what Dr. Nash does in his Leaders in Homeopathic Therapeutics. He compares anacardium with nux vomica very well right from the beginning, and he tells that anacardium also has dyspepsia, nux vomica also has dyspepsia. Anacardium will have pain in the stomach only when empty, relieved by eating, whereas nux vomica will be relieved when the process of digestion is over. Pain is worse 2 to 3 hours after meals, but lasts only till the digestion is accomplished, and then comes the relief for nux vomica. For anacardium, this part is worse. Based upon this, he has cured many, many, many patients, and he gives us a case in his book Leaders in Homeopathic Therapeutics that there was a young lady of around 35 years old, had three children, and she was cured of vomiting earlier with the remedy arsenic album 40 potency. Now, all through his book, you will see that he has mentioned extremely high potencies or really low potencies. There is nothing in between, because he found that there is some peculiar symptom and this needs to be treated immediately with a very high dose of a certain remedy. He caught hold of the disease process, gave the patient the impetus to go ahead, and that's where he cures patients. Whereas we nowadays struggle with 200, 1M, 10M. By the time the patient's perspective, the patient's mentality, the patient's physiology changes, and sometimes we not able to cure them, which is what is very disturbing. You should know the right potency, the right medicine at the right time. This is what helps every homeopath succeed in their practice. So going back to this case of anacardium, there was this case where she had some digestion trouble, and earlier she had some vomiting which was relieved by arsenic album 40m, but the digestion trouble was not eating at all, and the pain and vomiting came on when the stomach was empty. So anything that has to do with emptiness in the stomach is anacardium for you, my dear friends. She eats and she feels better, and then the substance was also vomited, and the patient's history, family history, pointed to sister having CA breast and nervous and fearful stomach, and anacardium relieved promptly. So this hypothesis of comparing nux vomica and anacardium, which Dr. Nash begins with the case of anacardium, he will tell us that there are two main points of differentiation between anacardium and nux vomica, and do not use nux vomica indiscriminately or abuse it just because it's a case of gastric disorder. The first thing is anacardium has insufficiency or paralytic state of the rectum, whereas nux vomica has irregular peristaltic action. So imagine nux vomica like uh, a, something which is cramping and releasing, spasmodic action coming and going. This is nux vomica in its essence, whereas anacardium will be plain stalemate, no movement, no desire, no activity. If you understand this and the patient symptoms are correlated to this hypothesis, you will probably find good relief in GIT cases. Second thing, what anacardium and nux vomica is differentiated at is a sensation. Anacardium has a plug-like sensation, lump-like sensation. Something is stuck up in that part. It can be throat, it can be stomach, it can be anal region. Mostly it is the lower gastric intestinal tract. Whereas nux vomica will have the desire, frequent desire, but it is irregular and it is over action or over activity of that part. So once you understand this, your job to prescribe anacardium more often and nux vomica less often becomes clear, and you will start using both the remedies judiciously when it is required and not abusing them. Anacardium is one of the remedies for memory loss, especially in old people. Many remedies have this particular symptom. Anacardium is one of them. There are two peculiar symptoms along with the loss of memory which Dr. Nash has conveyed to us. Irresistible desire to curse and swear, and the patient feels as if he has two wills. Now, there is a rubric also in our repertories, old age repertories, not the latest ones. You go to the old repertories, you will find that there is a contradiction of will, antagonism of self, etc., in different repertories. And all the dementia cases, memory loss cases will be like this. They'll be divided in between two opinions whether to do this or that. And he has also given a particular case in the remedy platina. Go back to platina, read platina, and you will understand how will you differentiate anacardium and platina. So that's where he tells about anacardium. There is a hoop or plug around the parts. We read about this in this particular symptom. So Dr. Ruturaj, very nice question. How will patient manifest his symptoms? Memory loss will be directly told. Irresistible desire to curse and swear, you will see that patients come to us and they are in a compensated state. They will behave so orderly, they will behave so nicely, they will never tell their bad qualities to us. There are two things we can do. One thing is, if they have come to us as a individual only person with us, so we will have to ask him different life examples and understand what he does in life examples. Chances are most of the patients will tell you that I do curse and swear, I tell bad words, I want to hit that person, I have that violence in my mind. That's where we will be able to catch it. If they are with someone, we will ask them some examples about the behavior of the person by making them sit separately at a certain time. one after the other, and you will be able to catch this part of irresistible desire to curse and swear. For patient having two wills, my go-to question always in all the mind symptoms after the entire case is about you know about memory. Now you should follow particular case taking protocol, and you'll have to customize it based upon your own practice and your own practical experience, and what did you learn from different homeopaths. So my way of approach is that mind symptoms are really flexible in the entire case taking. I can even start with the mind symptoms. I can even keep on observing them, and I note down at different points in my case taking about what their behavior is, so that I can, note it down and uh, see what they are behaving, whether they are too much close to the table, they are too much comfortable, they are too much awkward, throwing things or putting down the files. There will be different behaviors. You'll have to differ, infer your own uh, observations based upon that. So in such a scenario, you will see some patients who will have two wills. Many times I feel that I want to do this, I want to do that. Patients who will have these symptoms, they will either tell you directly, or else in your case taking pro forma, you can also have this question that there is irresolution in the patient, or you can ask them that what is your decision making capacity. Do you feel you can take your own decision, or you want some help, and how is it, can you explain? Take examples again, and you will get your probable answer to fit into a particular rubric or a particular understanding, so you can form a rubric out of it. So that's what I answered Dr. Ruturaj's question. I hope it suffices you. For more such interesting case taking examples and practical examples, I would urge you to stay following Homeo Setu on different social media platforms. And there is a channel also on Instagram which you can follow, so you are updated with, something which is practical and you are aware of it. Next remedy, what Dr. Nash explains us, is alumina. Now we all know this remedy, and there is a lot of academic therapeutics mentioned about this remedy, how we should prescribe, what we should prescribe. But what is interesting is that Dr. Nash compares this remedy with bryonia, peculiar constipation, inactivity of rectum, soft stool strains. And like bryonia, there is no desire to stool. Both the remedies complement each other, excellent remedies in infantile constipation. So, in all cases where children are getting used to potty training or getting used to pass their stools without the diaper, they will have these complaints of unable to pass the stool in presence of others. It can be natramure, it can be ambragresia, it can be alumina, it can be bryonia. Choose the remedy based upon physical generals and other symptoms, and chances are you will fit in one of the remedies in the patient. Anacardium sepia and veratrum album and silicea are also nearly similar to alumina in this regard of infantile constipation. And other thing what Dr. Nash tells us is that alumina is having a generalized condition of paleness, weakness, tiredness, must sit down to rest. And menses are scanty, delayed, pale colored, and after the menses, the patient is exhausted. We see this very frequently in Oculus and Cargo Animalis. So, all those cases of dysmenorrhea, severe pains, severe exhaustion after menses, during menses complaints also, these three remedies can be given a thought. Along with this, there is profuse leukorrhea in alumina, which runs down to the heel if they do not wear a cloth. That is mentioned very importantly. And leukorrhea is as profuse as the menses. So someone who is telling you that the uh, discharges from those parts are really enormous at many times, think of alumina as a remedy. The patient, alumina patient, will probably have lot of ridiculous and unnatural things which he wants all the time because of some deficiencies in him. And that is where he will ask for chalk, rags, charcoal, cloves, ridiculous things, or it can be anything which is not frequently consumed by people. So you have to pick up this analogy. That is the secret of practicing homeopathy. You have to pick up the analogy from these things. So for example, patient tells you that he has a desire for some things. In our source books, there is mentioned that only desire for chalk, rags, charcoal, or something like that, lime, or etc., or pica should be for these remedies. So it's not always those things. You have to take the analogy of desiring of the patient or a certain class of habit for something that is not a normal food, and then think of remedies like alumina. It can be calcarea phos, and prescribe. That is what will help you succeed. Pick up different analogies from different authors, different explanations, and prescribe remedies. Then you will probably get the idea of what homeopathy is all about. So similarly to alumina, we'll also have natromir, which cannot eat bread. Alumina cannot eat potatoes, and pulsatilla cannot eat food and pastries. Alumina will resemble pulsatilla in chronic nasal catarrh. Both are tearful in temperament. Alumina will have dry, thin appearance, but pulsatilla will be phlegmatic. And alumina is also good for hemorrhage from bowels. Now, some remedy which is really dry in the gastric sphere, how can it be useful for hemorrhage, is very interesting, because there is so much dryness that the whole gastric content is dependent on the peristaltic motion. If the motion is not helping, the blood vessels also try their best to push and propel the contents forward, resulting in an hemorrhage. This is why the analogy of understanding the pathophysiology of the different remedies is also important. So, last but not the least, alumina is also good for chronic sore throat. I remember many patients, come and tell us that they are having sore throat, they are unable to bring out the cough, and they'll do this. If they are doing it too frequently, urgentum is the remedy that you can think of, ineffectual desire to hawk. But there is alumina also, which is really nearly similar to argentum nitricum as well as argentum metallicum in all these throat complaints where it compels them to hawk. So why are they hawking? You should know that. You can ask the patients why are they doing this. So when we are as a homeopath seeing the patient, we also need to understand why is he doing like that. Once we understand that, you will have to ask the patient, why are you doing this and what is the benefit in doing this. That is where you will get some modalities, some peculiar sensations, some explanation from the patient. I did this because this was the reason, and you can then draw conclusions or even ask the patient for the end point of what is the benefit of doing such and such thing. For example, hawking desire. So if the person is hawking due to dryness of the throat, alumina is the remedy that you can think of. And last but not the least, alumina is also a very good remedy for locomotor ataxia, heaviness of the lower limbs, drags the limbs while walking. You will have seen a peculiar gaits in your, CNS explanations that patients drag their heels. Once in a while, if you get such patients, alumina or such heavy metals or such metals, such remedies from the mineral kingdom especially can be taught, especially the spinal diseases. They are much more, uh, you know, giving benefit in cases where you have given mineral remedies especially. So there will be some cases where you will have to give plant remedies, but there are cases, most of the cases will get cured with the mineral remedies itself. So last but not the least remedy for the day is alumen. He has not explained much. He was a homeopath from the early 1900s, 1890s, or around the end of the 1800s. So you will not find much explanation from the you know, these point of views where you want some thematic understanding, but the latest authors have given a lot of understanding about Illumin, Illumina from the thematic point. So every author will have his essence. If you want to master homeopathy, you'll have to learn every different authors, and that's where we end up today. For Illumin, Dr. Nash tells that typhoid, hemorrhage from the bowels, stools are dark clotted, relaxed uvula, and sore throat. Those are the three things he mentions. But for thematic understanding and more materia medica of the remedy Illumin, you'll have to read different latest sources, which we will take up sometime later. So that's all from Homeo Setu YouTube and Instagram channel. If you find this useful, share it with your friends and stay following us so that there is some interesting learning which is going to come up very soon on our page everywhere across.